Back now at 7:40 with Pill Nation and an in-depth look at all of the medicines that Americans take. All right, more than 4 billion prescriptions were written in 2011. That is the most ever. Everything from sleeping pills to drugs for anxiety and depression, you name it. NBC's Tom Costello is in Washington with more on this. Good morning, Tom.
Hi, Hoda. While modern medicines help us cut cholesterol, high blood pressure, heart disease, they've allowed us to manage pain and live with chronic illnesses. The question medical ethicists are asking is whether we're all taking entirely too many pills for our own good. It was pain like she had never known before. 10 years ago, Kathy Nicholas Verasso slipped on black ice, breaking her neck and causing permanent nerve damage.
I would sit in the ball in the bottom of the shower and cry because I didn't want to cry in front of everybody.
It was only when doctors prescribed methadone, a painkiller often used in addiction therapy, that she found relief. Without it, she says, she might have given up.
I wouldn't be alive. I was at the point where I was seriously considering suicide just because I couldn't take the pain anymore.
Thanks to the methadone, she has her life back. Nationwide, Americans are taking more prescription meds than ever before. More than 15 million Americans take painkillers, hydrocodone, oxycodone, and tramadol among the most prescribed. 5 million take a sleeping aid, while a staggering 18 million take antidepressants. The risks? Emily knows them all too well.
I've lost everything, and like something that started with just a prescription has led me into places that I never, ever thought that I would go.
Emily was a high school cheerleader accepted at Penn State when she underwent chest surgery to remove a cancerous mass. She was already taking anti-anxiety meds. Soon she was dependent on, then addicted to the painkillers.
It makes me more comfortable in my own skin, like I'm invincible.
The government estimates 2.1 million Americans are addicted to prescription meds. ERs treat more than 1 million prescription ODs each year. The most common misused drugs: anti-anxiety, sleeping pills, pain relievers, and antidepressants.
We also do seem to be a country that turns to drugs for solutions more than many other industrialized, wealthy countries do.
At Brigham and Women's Hospital, Dr. Jerry Avorn says something changed in the 1990s when it became legal for drug makers to advertise.
And that's created a sense on the part of many patients that, oh, I saw that ad on television, I think I should be on that medicine.
Demand for drugs skyrocketed, but the drug industry says the ads only inform consumers of the help that's available to them.
But all the research and the development in the world doesn't do any good if the people who could benefit from it don't know about it.
Kathy Nicholas Verasso says meds have saved her life. While at the Phoenix House in New York, Emily says she's finally kicked the prescription meds and looks forward to resuming her life.
I feel good. Life without the use of drugs is amazing.
The CDC tells us that more than 22,000 people die each year after overdosing on prescription meds. Many doctors say accidental overdoses can happen all too easily when patients, especially the elderly, don't follow doctors' instructions. Hoda.
All right, Tom Costello, thank you so much. Gail Saltz is a psychiatrist and Today contributor. Hey, Gail, good morning.
Good morning, Hoda.
All right, there are people who need drugs, and let's just take them off the table for a second. And then there are people who want them. They go to the doctor's office, and they can get a prescription because they want a quick and easy fix. Are doctors just kind of too quick to prescribe these meds, do you think?
I think it is a dual problem. Patients are quick to ask for them, and doctors are quick to give them. And some doctors are giving them who aren't doing the kind of evaluation that you would hope for if you're going to give it for the specific thing that they are.
Mm-hmm. And these drugs become so addictive. They talked about the anti-anxiety meds and those kind of things. What's the danger? You start on one of those because you need it, and then suddenly you can't live without it.
Exactly. I mean, some of these are actually biochemically addictive. So you do start with something, say a benzodiazepine for anxiety, and you do develop a tolerance. And then you need more and more of the same medication to have the same effect. And then soon you have a problem. And that's exactly what we're seeing here. We see that with pain medications that are some of the most abused medications, anxiety medications, and then there's sleep aids and antidepressants that people would benefit from another kind of treatment, to be perfectly honest.
Like what?
Psychotherapy, sleep hygiene, education, so that they have ongoing coping skills and don't relapse. And that's really a better treatment for them, but we don't do it. Why? Because it's not as fast.
Yeah, we want the quick fix.
Exactly.
All right, Gail Saltz, thanks so much. Thanks for being here.